So aside from using PPE or wearing proper PPE, you also have to observe social distancing to prevent COVID-19. So you should stay at least 6 feet or 2 meters apart from one another. Mass gathering or crowded areas should be avoided. Social distancing posters are posted all over the hospital. You should stay at home if you are sick or exposed to sick household members. Immediately inform employee well-being clinic and your manager if you have any of the following symptoms. As I mentioned earlier, if you have fever, cough, difficulty of breathing, sore throat, headache, runny nose, diarrhea, nausea or vomiting, weakness or fatigue, loss of taste, loss of smell, or muscle or body aches, consult immediately employee well-being clinic for proper assessment. If you have mild symptoms, immediately isolate yourself and do not report to work. This is to prevent transmission of infection to other hospital staff. You can do teleconsultation in our employee health clinic. If with persistent fever, difficulty of breathing, or dehydration, you have to immediately consult emergency department for assessment and alert your manager of your condition. Reminder, if you are at home, you have to observe social distancing. Wear your face mask, perform hand hygiene. Stay in different rooms from other household members. Perform frequent cleaning and disinfection. If household member is sick and staff is exposed to the sick household member, inform EWC and your manager. So we have home quarantine instructions that you can download from our MMC website. So it contains detailed instruction for home isolation. If you are on strict quarantine, or if you are waiting for COVID testing result, or if you became a confirmed COVID-19 patient, so you have to observe strict quarantine. Inform EWC and your manager if you have no quarantine facilities or at home or cannot be accommodated in quarantine facilities. If you are in hospital quarantine, stay on your room and wear mask at all times. Avoid going out of the room. For COVID suspect cases, only one staff per room is allowed. Cohorting can be done for confirmed COVID-19 cases. Employees to do self-monitoring of symptoms. So if you experience any symptoms, inform your manager and employee well clinic. Things to observe during lunch or snack times. So there are documented healthcare workers who get infected because they are eating together. So here are the things to observe during lunch or snack time. You have to consume food at the designated sitting areas marked in your pantries, so pantries should not be crowded. Maximum of 3 persons is allowed depending on the size of your pantry. So we have to observe social distancing, so you have to schedule lunch and snack breaks. You should avoid crowdings and gatherings. Perform hand hygiene before and after eating, and keep the pantry clean after use. Do's and don'ts in the pantry. So you have to bring your own water bottle, cup, and glass. Always wipe the water dispenser faucet with clean tissue before and after use. Avoid direct contact of the water bottle container rim with the faucet when refilling water. Discard spoiled food in designated bins. Store food properly to avoid contamination and spoilage. Keep the pantry clean after use. You have to remove PPE before entering the pantry and maintain social distancing. The don'ts in the pantry, of course, do sharing of drinking containers, crowding and gatherings, loitering, sharing of utensils. So another thing to monitor are staff for signs and symptoms. So employees are now required to answer an online employee daily health check before entering the workplace. So you can access the online employee daily health check through the QR code. QR codes are located in different entrances of the hospital. After accomplishing the form, an email notice will be sent to you your provided email. Okay, so this is an example of the SharePoint notification from the employee daily health check. Remember to always accomplish the employee daily health check. And if you have symptoms, immediately consult employee well-being clinic or emergency department if EWC is closed.